Welcome back, everyone. This stretch of incredibly hot temperatures we're having right now can bring the increased risk for our hearts. According to the American Heart Association, extreme heat may raise the number of incidents of cardiac arrest. This kind of medical emergency can happen without warning, including in young, seemingly healthy people.
So for more ways for everyone to try to get ahead of it and what you may be able to do to reduce your risk, we want to bring in an expert, Dr. Vivek Goswami, cardiologist with St. David's Heart Hospital of Austin. Thanks for joining us again. It's so good to see you.
Thank you for having me. Appreciate it.
So first, explain exactly what cardiac arrest is, maybe how it differs from a heart attack or some of the other heart conditions people may have heard of.
Yeah, it's a great question. When we mention cardiac arrest, usually the implication is a problem with the electrical system of the heart. So the heart either stopping or forming a very erratic arrhythmia that can often be incompatible with life. When we talk about a heart attack, the implication is more that of circulation issue, a blockage that can lead to stents, bypass, etc. So both of these, fortunately, tend to occur in older individuals, but the former, the cardiac arrest, can sometimes occur even in younger individuals if they have a genetic predisposition, certain exogenous exposures, etc. Or, as you mentioned, in cases of extreme exercise during heat, dehydration. So sometimes there could be an underlying substrate that normally the individual tolerates, and then that dehydration combined with heavy exertion can precipitate this underlying issue.
So if someone suffers from cardiac arrest, what is the treatment option for that?
Well, it really depends on what's causing it. So a majority of cardiac arrest is due to a primary cardiac condition. So if the person has a predisposition, such as a structural abnormality of the heart, we'd certainly want to get ahead of that. If the person has a malignant family history of sudden cardiac death, certainly that would warrant further testing or seeing a sports medicine physician or a cardiologist, or if they have a predisposition based on their electrical system. It depends on what's causing or what the substrate is, but oftentimes we'll avoid exertion or even put in defibrillators in extreme cases.
How difficult can it be to identify what's maybe causing that? Because you say there are a few options that might lead to that happening.
Yeah. No, it's a real challenge because oftentimes these individuals are seemingly very healthy and they're not having any symptoms, and sometimes the first symptom of a problem is sudden cardiac death, right? So really getting ahead of things with proactive screening, if there's anything to suggest that there's exercise intolerance, patients passing out, having racing heart episodes, I think certainly seeing a physician that's specializes in sports medicine to see if appropriate testing is in order. Fortunately, these things are very rare, especially in younger individuals, but tragic nevertheless when they occur.
So if something like this were to happen, I mean the worst of the worst to happen, of course calling 911, is this a situation where CPR would come into play?
No question, no question. So early application of CPR and using an AED is extremely important. That can often make the biggest difference. And when we get trained on things on AEDs and CPRs, remember you're more likely to use that on your friends and family than some strangers. So I think it's a skill that all of us really should adapt, because you never know when it's going to be needed.
You spoke on it a few times there, but just to reiterate for people about what the symptoms of perhaps the onset of cardiac arrest, what that looks like, what people should maybe be mindful of.
Yeah, again, understanding the first symptom can often be a bad one, but in general, if someone is experiencing any change in their exercise tolerance, they're able to do some type of physical activity, which is more difficult now. If there's passing out spells, if they're feeling their heart racing in their chest, if they're having chest pain with exertion, if they have a family history of early sudden cardiac death or cardiac arrest, these are all scenarios that may require evaluation with a sports medicine or a cardiologist to see if further testing is appropriate.
If someone has that family history, they know they're maybe more at risk, are there things they can do to reduce their risk?
I think so. And again, a majority of the time when it is due to a cardiac abnormality, we can see those structural abnormalities in advance. So running a simple ultrasound over the heart, if the heart is structurally normal, the likelihood of having sudden cardiac death or cardiac arrest goes down. If the electrocardiogram is normal, the risk goes down. So there are things we could do to build a story in that individual. We could do stress testing, et cetera. So if those things are normal, it makes the risk come down significantly.
Well, Dr. Vivek Goswami, we appreciate you always coming in and talking about all the kinds of different topics, and especially this one. So thanks again for being with us.
Appreciate the opportunity. Thank